Hello, hello. Welcome back to the show. Welcome to Restore the Real. Today we've got a great guest on. He is local here in Southwest Idaho. So if anyone is looking for a biological dentist, I welcome Dr. Sam Peterson. He is a biological dentist. He's a husband. He's a father. He is a junkie for continuing education and research. Really, that huge passion of his. And yeah, so Sam, Dr. Peterson, welcome to the show.
Thank you for having me. I'm excited to be here.
Absolutely. You know, one thing interesting, and I'm going to let you share your story, but most people that are in this space are in it because they had to be. I mean, they didn't have to be, but like they had a condition that led them into here. But your story is when you shared that with me a few weeks ago, I was like, dude, that's awesome. So I'd love for you to share what led you into biological dentistry and what were you doing before this and why did you change?
Yeah, yeah, good question, and it's kind of a big story, but yeah, long and short of it is, so I was actually working in finance. I had no intention at all of working in the medical field. I didn't really have a whole lot of interest in that. Nobody in medicine in my family, and I actually went to school for finance and went to work for Merrill Lynch right before the 2007-2008 crash. um, and had a very interesting road as far as that goes. Just kind of getting a front row seat to everything that went on with that. So seeing, yeah, I mean, really just kind of how the big corporate inner workings are, and how really intertwined the financial markets are with the government. And over the course of a number of years, I kind of became disenchanted with the financial world. And my wife was working as a dental assistant at the time, and she would tell me all the stuff that her doctors that she was working for were doing, and I just kind of joke around about how I should have been a dentist. And I'm like, man, that sounds interesting. That sounds fun. Just hearing all the different things they were doing. And anyways, eventually, a good buddy of mine who actually he was working as a pharmaceutical rep at the time, and he called me and he was like, you know what, I've had enough of this nonsense. He's like, I'm going back to dental school. And I was like, well, for crying out loud, if he can do it, maybe I can do it. So I actually, I left my job, left my, nice situation in the financial world, already kind of had established some roots and stuff that way. And we went back to school, went back to dental school. And while I was in school as well, I was one of 4 students that got a tandem master's degree in oral biology, in addition to the uh, DMD program that I was in at the University of Louisville. So, so that was kind of what led me into dentistry. And then right around that same time that we were making that shift, and right before we started dental school, my oldest daughter was diagnosed with an autoimmune condition. And to your point, right, most of us that find our way into some alternative medicine spaces, it's um, because of that, because of a necessity, because
Right.
something shakes us out of our apathy and out of our traditional way of thinking. And the condition she had was vitiligo. So we went to the dermatologist. She was losing some pigment. Vitiligo is one where the melanocytes in the skin get attacked, and so she was losing pigment. And we went to the dermatologist, and they said, "We don't know what causes it. We don't know how to cure it. Here's some cream that some steroid cream people have good luck with. Good luck." And that was it. And frankly, that was just an unsatisfactory answer. And so while I'm going through the program of dental school and stuff, I started a deep dive into um, books on gut health and autoimmune disease, and just really kind of opened my eyes to this completely different world that existed, and we were not crunchy at all, and we were eating all the traditional American nonsense, which when I look back on, it's pretty disgusting. But we, so we made some drastic changes while we were in dental school and stuff, and we're able to reverse to a good degree her condition, and we were able to, up to this point, she hasn't had any relapses, hasn't had any additional pigment
So
loss
cool.
and stuff. So yeah.
So you got a degree in oral microbiome in the oral microbiome. You got your DMD, but then I mean biological dentistry is not readily taught in dental school.
Yeah.
So why that? And what I loved about what we had talked about previous was the importance of questions. And how did that, I mean, because that's a big jump,
Yeah.
right? And you can be looked at as, what are you doing that for? Like,
Right.
just be a dentist.
Right. Right. Yeah, and that's something that I've always been, especially with that history in finance and stuff. And like I said, I'd become kind of disillusioned by some of that, and seeing some of the blatant corruption and conflicts of interest and stuff. And it was just like,
Because there's none of that in medicine. I
yeah.
mean,
Well, and that was kind of the funny thing too, is I was, on the one hand, my eyes were like wide open, but on the other hand, I was still like very blissfully naive, because when I made the shift to dentistry and stuff, I was like, finance is corrupt. There's a lot of problems here. You know what's still untainted? Medicine. That's a pure field where you can like treat people, and anyway. So it was kind of kind of funny to then get into it and be like, oh, wait a second,
wait, maybe it's not.
wait a
Wait, maybe
minute.
it's more.
Yeah, arguably, just as much or more so. So, but yeah, so I've always been one who asks questions. And if something doesn't make sense to me, I'm going to pull at that thread until it does. And even before I had gone into dental school, I had watched a number of documentaries on fluoride and mercury fillings and stuff. And it's like, all right, if I'm going to be around this stuff, I want to hear the other side. What do they got? And you know, a lot of those arguments were pretty compelling.
Right.
And so when I got to dental school, even, it was kind of like, okay, well, let's hear what the institution has to say about these things, and well, I mean, some of the arguments didn't really like stack up in my mind, and they've got plenty of data, they got plenty of research and stuff, um, but it's still one of those things where just in the application of it, where like we would place an amalgam mercury laden filling in somebody's mouth. In our clinical rotations, we had to do a certain amount of amalgam fillings, and to show our competency and whatever. And then we had to take them, like we'd have to take the scraps, and we have to take the scraps. We had to like double glove and take the scraps and put them in a special container, and put that container in another container, and then the EPA comes and picks that up and disposes of it in some safe way, because it's illegal to put it down the drain. It's illegal to put it in the garbage can, but it's completely safe
Safe to be in your mouth, yet you
it's
have to
safe.
take all these precautions
Yeah,
to
yeah,
dispose of it.
but so the only safe place that it can be is in a patient's mouth, where they're chewing on it and licking it, and all that, and even the conditions in which like mercury off gassing occurs from those mercury amalgam fillings is where there's heat, where there's abrasion, and where there's galvanized currents, which is the condition that is your mouth. And so to me, it's just, um, like I understand, when like they were created, like back in the 1830s, it's an 1830s technology. I understand, okay, maybe back then, but we have better stuff now. We have better
Right.
materials. We've progressed to a point where that type of stuff is no longer necessary in my mind and should be reconsidered.
I'm curious, before we get into like the nitty gritty on this, how are you received? You're asking questions, you're curious, you're in dental school where, the institution is the authority. How are you received when you pushed back on stuff that you didn't
Yeah,
appreciate,
I
that you
mean, well,
didn't?
some of that stuff, I mean, I would just ask questions. It was just an honest
Right.
inquiry, right? And same thing with like fluoride and stuff. It's like, well, I was just kind of the guy in the back that would raise my hand back. Oh yeah, hey, what about that? Like, or what about this? And I wasn't being like argumentative or a total
Yeah.
contrarian. It was just like, hey, could you explain this, because what you just said doesn't quite make sense given this factor, or this other thing that you just explained. And it was like, okay, so just could you go over that a little bit more? And so it's one of those things. I wasn't like met with a whole lot of animosity or anything in dental school. It wasn't that, but it was more just some of the answers in my mind were just kind of, left me wanting. They were kind of inadequate. And then, the other thing is a classmate of mine was also, he's a biological dentist as well. And his dad was a biologic dentist and stuff. And so, he and I are still great friends and stuff. And when his dad would come into town, we'd get together and I'd be like, all right, okay, so like, what about this? Because some of the stuff, even that, it was like, okay, I can get on board readily enough with like, fluoride's toxic and mercury's toxic. That's kind of the easy stuff. But some of the other things, it was like, the same thing. Like, prove it. Prove to me that
Right.
that this road is really better or less toxic. It's like, and so some of that took a while for me to come around to as well. Just, I didn't want to abandon one dogma just to subscribe to another,
Right.
because even in the world, as I'm sure you've seen, in the world of functional medicine, in the world of biologic dentistry, sometimes people can get, just as dogmatic and kind of, they're like a little bit of a zealot
Right.
mentality where
Yep.
they're like, oh, it has to be this way because it's, X, Y, and Z. And it's like, well, again, I try not to get too dogmatic about any of it, and show me enough research, show me enough data, and I'm willing to change my mind on any one of these topics.
And I think that's so important that one, this curiosity is there to explore, and then second, to be open about, okay, let me just process and filter this, and based on that data and what resonates with me, what I feel, then let's move that direction, and to not be afraid to do that. I think a lot of people are afraid to question authority, whether it's doctor, dentist, whoever it is, because of experiences in the past. But I mean, as you've so outlined, like that was instrumental and critical in where you were, where you are,
Yep.
where you were, where you are now, and so I love that you shared that, and that you're open to, if you see new data and things change, then it's like, you know what? I'm open to that. I'm not closed off. And I think that's really important to, again, not become so dogmatic, because it's really easy to take any one of these things in functional medicine or health and say, well, it's just this. This is how it is.
Right.
And we see that in camps with nutrition, with vegan,
Yeah.
keto, paleo. It's like, well, I'm
Yeah.
this.
Yeah.
Really, you're
It becomes
defining your entire existence
it
by
it almost
diet?
becomes its own religion,
It
right?
does.
Where there's
No.
that kind of zealousness and uh you know there's just yeah, I mean, just even how people react, they have a visceral reaction if something goes slightly contrary to what they now hold as their core belief. And to me, like I said, I just said ask questions and I follow the data. That's it's just
Yeah, and that's awesome, and I love that. I love how you've talked about that, and sensing that from you as we talked
and common
before.
sense, right? Because that's the other thing too, is
Yeah,
there's plenty of there's always, and there always is, right? Because of these conflicts of interest and because of these different corporate groups and stuff that stand to benefit or lose out on different things, right? Like, there's always research to support said, you know, procedure or material or whatever, but there's also then there's the research from the opposing camp. And so some of that too, it's taking in your clinical experience, but also just some common sense. Just like, think it through. Does it make
yeah,
sense, and does it resonate? Does it feel right? And you know and there's part of it that goes that way as well. But does it
yeah,
sit well with your gut?
yep. Well, speaking of gut, then let's jump
Yeah.
into how to, like, really into the nitty gritty. So what are, when you look at someone's mouth, and maybe even if someone at home, if they look in the mirror and look at their mouth, what are some things that you see right off the bat that are indicators to you that, hey, we have a problem here?
Yeah.
And then if you would, not from a, well, from your standpoint, but can people look at that and see things at home that are like, hey, wait a minute, this isn't right. There's something going on here that could be a bigger problem.
Sure, sure. Yeah, I mean, really, it's pretty amazing what we can see, just by looking in the mouth. And I'm sure other people who are trained in other, specialties and stuff, feel the same way when they, look at their, extremity or body part or whatever, right? That there's generally, there's a lot that they can glean from, you know, certain things that they see. But definitely in the mouth, I mean, it's a treasure trove of information. People open their mouth and right away, we can see potential. I mean, airway issues is a big one that we screen for and stuff, so whether it's a tongue tie, the Malin-Potty scores is something that I look for. That's how much, room is in the back of the throat. Are the tonsils getting in the way? Is the soft palate drooping? Is the tongue, particularly large? Is it impeding the airway? So that right there, right, airway, if they've got, any issues with sleep apnea or potential risk for sleep apnea, the consequences that come from that are, high blood pressure, elevated
Huge.
cardiovascular risk, dementia, higher risk for different autoimmune diseases, and I'll see that right away, right, when I look in their mouth, right? So we're able to identify those types of risks right away. On the teeth themselves, there's oftentimes there's little, there's pitting, there's a difference between pitting, there's a difference between wear and attrition. And we're able to see, is there an acid reflux problem? Is there either an intrinsic or extrinsic acidic contributing factor that's damaging the teeth, and sometimes that, right, if they have GERD, if they've got silent reflux, that increases their risks of esophageal cancers, among other things. So some of those things that we see right away. There's specific decay patterns, that if we're seeing a lot of interproximal decay, or the cavities right in between the teeth, generally that's either one of two things. Either your diet is not where it needs to be. There's usually a significant dietary contributing factor when we see a lot of that type of decay. But if your diet's super clean and everything's, as it should be that way, and we're still seeing that types of decay, oftentimes it points towards a hormonal issue. So then I'll be sending people to have their thyroid checked and their adrenal function and stuff, because that plays a huge role in the internal defense systems of the tooth.
Right.
So it just kind of, there's a number of those things that just by looking, that's not swabs, that's not DNA testing, that's not any of this kind of stuff. That's just a visual, once over, that it's like, oh, we've got this type of risk, and there's, so it's pretty amazing what you can see.
That's cool. I'm curious on the tongue tie. Do you see that? And you don't see pediatric. You're not set up for pediatric clinic right now.
Correct. We
But
still
in
see a fair amount
adult,
of kids, but
okay,
we see 10 and over,
okay.
and stuff. So we definitely check for that, and I screen the adults as well.
Do you see that? Like, is it more common than what people would think? Because, you're born and doctor looks at it, oh, great, no tongue tie. But I've heard that it's actually way more common than what is
Yeah,
screened for at birth.
to me, that's another one of those things. It's kind of a personal issue for me, but I definitely screen for it in adults, and it's something that we see, fairly regularly. It's not every patient and stuff, but this is a, again, where it's such a contributing factor to, the sleep apnea and those issues. In kids, if you catch it early, and change that and release that and stuff, it can actually significantly impact the way their face grows, the way their
Hmm.
actual facial development and stuff ends up. In adults, your face is already set, um, but if you can eliminate a risk factor for sleep apnea, or alleviate some of the symptoms maybe that people have been having. My mother, she is, she was diagnosed with an early onset dementia. She's really not that old. She's 72, and she's, um, a few years into this, cognitive decline, and which is awful. I wouldn't wish that on anybody. And it wasn't until after she was diagnosed that we also noticed that she's got a significant tongue tie. So it's something that she hadn't been screened for. And she was diagnosed with severe sleep apnea shortly after being diagnosed with an early onset dementia. And, and it's one of those things. My mother is she's a very petite lady, and a lot of people associate sleep apnea and stuff with like being obese.
Right.
And she's not. she's always been very thin, very petite woman. But she, as a kid, we almost thought it was funny because, like if mom went and took a nap or something, we'd hear her in there sawing logs, and it was so, we'd hear this such a loud noise, coming out of this tiny woman, and as a kid, we thought it was, kind of funny. Well, you fast forward to that after years, night after night of actually being deprived of oxygen, to the point that now, that's a huge contributing factor to cognitive decline. And that's not funny.
Right.
It's not funny anymore.
Yeah.
It's, you said it's
your mom.
It's my mom,
Yeah.
So it's personal too when we screen for these things. Like when I notice a severe tongue tie in an adult and stuff, we still make the recommendation that, hey, especially if and is it consistent? Have you been having sleep disturbances? Oh yes, I have. Okay, well, what about this? What about this? And it's like, yeah, we should probably get you in as well to consider having a revision done so that you're 40 now, but what happens in 20 years?
Right.
So
I bring that, and thank you for like sharing so much of that. I read James Nestor's book called Breathe,
mm-hmm.
and he did all sorts of experiments on himself with other people, and it was incredible when they plugged his nose and he was breathing through his mouth only, and how fast his body started to, I'll say, erode. And the bacteria that developed in the mouth and in his body, and what happened to him physiologically. And it was incredible. And then when they unplugged his nose after 10 days, and this was only 10 days.
Yeah. Yeah.
Right? This is not a lifetime. This was 10 days. And then they unplugged, and he said it was like hell. At the day 9, day 10, he was just praying that I can't wait for these plugs to be removed. And then they were, and how quickly his body recovered and changed, like this whole bacteria overgrowth that had happened in his body now began to revert. And so it's, and you get to see this. You are one of these frontline people that can see what's going on in the mouth right away, to where adults may have no idea that their mouth has anything to do with sleep apnea. They're given a CPAP machine and just told, go home and use this.
Which dries the mouth out further,
right.
And it is what it is. They've got to be able to breathe. But yeah, I mean, that's a huge contributing factor as well, where sometimes people come in and they're like, yeah, I always struggle with cavities and stuff. And it's like, okay, when you point some of these things out, it's like, are you breathing through your nose? Are you a mouth breather? What's going on? And it's like, well, yeah, I've been a mouth breather forever. And it's like, okay, well, just to your point there, that it does. There's a shift in the oral microbiome when your saliva can't flow and keep the teeth, covered and protected. And,
right.
So yeah.
Well, let's get to that. I was fascinated when I came to your office, and you do something that I've never seen another dentist do, where you'll take like saliva or the plaque and put it under a microscope.
Mm-hmm.
And show it to the person, right? I do that with live cell in the blood. It's pretty fascinating what you see in the blood. I've never seen this done with the mouth. So I would love for you to, one, describe what you're doing, why you're doing that, and then just take it away and share your screen, and let's give people a visual. So really important, if you're listening, you want to go to YouTube and take a look at this. And the word stunning, I don't think does it justice when you see what's going on. And because the microbiome is so elusive, it's like, well, yeah, it's in our gut, it's in our body. What does it look like? What impact is what I'm doing having on it? Well, this shows impact of what your health decisions are having. And it's just by maybe a little piece of plaque or saliva, and it's crazy. So describe what you do, why, and then let's turn on the camera and let
Yeah.
people see.
Sounds good. Yeah. So this is something that's kind of wild. So, and again, I'm always asking questions and I'm always looking to improve and get more information and stuff, so this was something that we actually brought on this last year in our office. And it was one of those things that's pretty mind blowing to me too. Because it's, as a dentist, right, we talk about, like, I'm sure some of the listeners here can relate to this, but when the dentist says, "Oh, you need a deep cleaning," right? Which I hate that. I hate that terminology. I always have. When it would be, "Oh, you need a deep cleaning," and I understand they're just, it's vernacular. They're trying not to use too big of wordy, medical terms and stuff. But the actual medical term for it is scaling and root planing, right? Which is also a terrible name, right? I mean, like,
Doesn't sound
no,
pleasant.
like, who wants to get their roots scaled and planed? Like, ask a carpenter if they want their roots scaled and planed. It's like, no, I don't think so.
Not really.
So, but when people use that terminology and they're like, "Oh, you don't need just a regular cleaning, you need a deep cleaning." One is that kind of implies that, like, our regular cleaning isn't deep. It kind of
Right.
makes it sound like it's not very thorough.
We're really not doing a
It's
whole
like
lot.
you need to pay extra for the deluxe cleaning. Like, this is just a basic cleaning or something. So I just hate that. I hate that terminology. It's a completely different procedure. So a cleaning, the terminology for that is it's a prophylaxis, which is trying to prevent this disease process from happening. That's what a cleaning is. It's a prophylaxis, which is, we're trying to prevent gum disease from happening. Scaling and root planing is a surgical procedure. Okay, it's a surgical procedure, which is why the hygienists have to numb you up for the procedure. They're actually going underneath the gums and they're busting up and cleaning out and debriding this infected tissue and these bacterial colonies that set up shop below the gums. And so that's what it is. So when they say a deep cleaning, that's not, it's very different
So would that
than a
include,
regular
like,
cleaning.
would that be like you're breaking down, opening up biofilm, cleaning
Yes.
out like that? And
Yes.
for people that don't know what biofilm is, biofilm are these microorganisms, viruses, bacteria, molds, that they essentially form this protective force field around them so that our body, our immune function can't access that, but they can send out these endotoxins that are wreaking havoc on our tissues. It
Yeah.
gets into our lymphatic system, the vascular system, and this can be a huge point of chronic inflammation and infection, chronic illness, because of how that does get into the vascular system and the lymph.
Yeah.
So
Yes,
that's really
100%.
cool. I didn't
And
know
it's,
that. I didn't know that difference.
yeah.
And I never understood that.
And like I said, it's one of those things. It's just this common vernacular used in dental offices where it's like, "Oh, you need a deep cleaning." And it's like, and patients, that's how they interpret it. Is they're like, "Wait, what?" They're like, "I came here for this, like, my $60 cleaning. You're running a special, and now you're trying to sell me on this, like, $500 cleaning." And it's like, no, this is just a surgical procedure. Like, this is much more than just a deep cleaning.
Right.
But to your point just there, with the microscope, we're able to see, we're able to see in real time, how balanced the oral microbiome is. Now, what we're able to see on a microscope, we're able to see the morphotype of the bacteria. So that's like the shape, right? We're able to see, is it spherical? Is it a cocci? Is it a rod? Is it a spirochete? We're able to see a number of these things. We're not able to tell the genotype. We need a specific DNA test for that. So I can't look at it and be like, "Oh, this is what it is." But we can look at it, and just knowing what we know about oral biology, we know which ones are bad. Like, spirochetes are always mean.
Right.
So it's like, and there's always good bacteria in the mouth, and there's always bad bacteria in the mouth. And on a healthy slide, sometimes we'll see a spirochete over there, or we'll see, some of these things over there. And that's fine. That's fine. It's when they start to coalesce. It's when they start to overpopulate. It's when the terrain of the host, right, has been compromised to some degree, and their immune system has, taken a hit, and these opportunistic infections happen where some of these bacteria overpopulate and start coalescing. As they coalesce and aggregate, they actually start to synchronize their movement. Okay? And as they synchronize their movement, their biofilms become more virulent. Their biofilms become more toxic, become more damaging. And over time, the tissue and bone are lost around these teeth. And the teeth, I've extracted a lot of teeth on people they don't have cavities at all, but the bone that supports the teeth has been completely destroyed by this chronic inflammatory process, and they end up in a complete denture because the oral microbiome is just completely out of whack, and destroys the tissue and bone.
That was pretty wild when you showed that to me, the coalescing of those and the movement together. It was like, oh my gosh, that's incredible. There's something called quorum sensing where
Yep.
it's like, one bacteria, it's like, hey, come over here, come hang with me,
Yeah.
come hang with me, come hang with me. And I often will tell patients that all these bacteria, that they're normal in the body, but it's like if you get one teenager, great, not a big deal. You get 50 teenagers together or 100 and put them in a certain direction and say, hey, just have at it. It's like, oh,
See
they're
the
going
collateral
to blow
damage
crap up.
that's gonna, right.
There's going to be some damage. So, and not all teenagers are great. I love my kids, but
Yeah, they
nonetheless,
would never
this
do that.
bacteria starts to act differently when it's in a group than it would when it's separate, which was amazing to actually visualize that and see it. That was incredible.
And this is why it's so powerful, is because you can actually see what we're talking about. Because I could show people, like, this is what a healthy slide is, and that's what I'm going to do. I'll share my screen here in just a moment, and I'll show people. Well, here, let me do that now. So let me see. There we go. Okay. So for those that are watching on YouTube, you'll be able to visualize this and stuff. But for those that are listening, I'm just showing an actual slide. So a 4K video of one of the slides that we have. And on this, there's
is this plaque or is this saliva?
So it's actually crevicular fluid. So we go underneath the pockets, like so where the gums kind of butt up to the tooth.
Okay.
And we take a little sample of this crevicular fluid, and we put that on the slide. So sometimes there's a little bit of plaque and stuff that gets on there and stuff, and that's fine. But yeah, I mean, on this is a fairly healthy slide, and you can see there's a some bacteria over here. There's some bacteria down here, and they're not really moving much. Let's see. It's like a little bit longer of a
So again, for those that were watching, that slide was pretty clear. There was not a whole lot on there.
And so this is a little better one right here, where you can actually see some of the bacteria moving, right? So there's a few here and there. You see them kind of dancing around, but there's not a whole lot of activity going on. And this is a healthy mouth. This is a healthy mouth. We've got bacteria present. We want it there. We don't want a sterile mouth. But when we see things that are so this one is more of kind of a moderate, what I'd call microbial dysbiosis. So things are just, quite out of balance, and things are starting to pick up. This is the teenagers really starting to get busy.
See a lot more bacteria in there moving around.
Yeah. So, and then even these long filamentous ones. So let me go back just a little bit. So right here, kind of these longer filamentous ones. Again, I can't say specifically if that is what I think it is, but it's usually what's called fusiform nucleatum, which is a bacteria that's a moderate risk for periodontal disease, but it's also a significant risk for a number of cancers, and a whole host of other systemic conditions. But when we see that in the mouth, it's one of those things, especially when it gets overpopulated. So let me, and I'll just pull this other one up. So this is another one where there's a lot of these filamentous ones going on. So these are typically, like I said, that fusiform nucleatum. Let me go back. There we go. And these right here, these are white blood cells. So we see the body's immune reaction to these. So these are all white blood cells right here, right there, right there. And we have just a whole host of these longer filamentous types of bacteria, which are, can be a problem. Some of these things aren't like this little green area and stuff. That's chlorophyll. That's, they probably had a salad for dinner last night or something.
Stay on that for a second. I think, and this is fascinating, that, here is your body in action.
Yep.
Right. You never see this until now. And can we appreciate like the intricacy that our body has? Like you have all these white blood cells. There's the you can't see my cursor, but like the circles were white blood cells, right?
Yeah.
And they're working to support our body, but yet based on lifestyle factors, based on toxicity, exposure to different things, it's going to disrupt and change that. So there's an interest in, I can't say that word, a complexity to this that is pretty amazing and beautiful how our body works. It's
Yeah.
incredible.
And one other, I'm going to show you two more, but this one here, this one, so this here, this is a sea, an absolute sea of white blood cells. So this is just all coalesced. This is a ton of white blood cells all over the place. And when we see this, right, I mean, somebody's immune system here is completely amped. So sometimes we see that maybe they just got over the flu, maybe they just came off a cold. But usually when we see this complete wall of white blood cells and the immune system completely going, dialed up to the nines, right? We spend a little additional time looking around on the slide to see, is there something else obvious on our end that's driving this heightened inflammation? And so this is one of the ones. This is one of the more intense slides that I've seen. So one of the crazy things that we pick up on these slides is not only do we see the bacterial dysbiosis, but we see parasites. We'll see parasites in the gums.
Okay, so for those of you that think that you don't have parasites, just know that everybody with a pulse has parasites. If you're alive, you have parasites.
Yeah. And sometimes we'll pick up on these. The most common one that we see in the mouth are amoebas. There's another one that we'll see, which are trichomonads that are typically an STD, but we'll see those from time to time. But definitely the ones we see most frequently. But I'm gonna pull this slide up, and you'll really be able to see so this is a 20-year-old patient, and the only complaint is my gums are sore. My gums bleed when I brush. And she comes in and her gums are completely inflamed. We take this slide and it's kind of alarming. So we see, this is where we can actually see the synchrony. Down here in this corner, we can actually see how they've coalesced. This bacteria is coalesced, and we can see how they're actually synchronizing their movement.
Can you make that any bigger?
Yeah, let me see here. So yeah, we can.
There we go.
There we go. So let me go back. So we can see how the movement of these bacteria are actually syncing up, right? They're actually flowing together. We see this movement stuff where it's just kind of pulsing in there. And this is a mature colony. If for it to synchronize like that, I mean, it's been here for a while. So just all these spirochetes all over the place. And then the nature of these spirochetes, you can see them, you can watch them. They burrow into tissue. They puncture white blood cells. I've seen slides of, these spirochetes literally tearing white blood cells apart. They lead to gum permeability, and the gum lining breaks down, and that's where you start seeing it, is these spirochetes get into the bloodstream, and then they start showing up on your blood work. But the other thing here that I'm going to point out, and then we'll go back to the normal screen, but right here is all of these, this here, these are all amoebas. This is a tiny little sample in this person's mouth that we took from just one little, we take it from 4 different pockets, we sample 4 different areas of the gums. But in that tiny little sample, we have, on just this one slide alone, literally hundreds, if not thousands of amoebas as I scrolled through this slide.
And amoebas, for those that don't know, are single-celled parasites, right? This could be like malaria is a type of protozoa amoeba. Babesia, one of the co-infections with Lyme, is a amoeba protozoa. So, and they're vast. Those are only 2 examples, and you can't, I mean, what you've said, you can't look at this and then diagnose and say, oh, it's this. You'd have to actually get down to the genotype and do DNA testing on it. But seeing this, there's a problem.
Yeah, I mean, this patient, I mean, like I said, the only symptoms she had was, just that my gums bleed. Something's not, something's off. But yeah, so she's like, yeah, my gums bleed and they're sore, and so I just figured I better come to the dentist, and I come in and it's like, oh my goodness, like you're actually you're sick, your body's been compromised and you've got a serious situation going on, and so you think just proximity again, proximity to major things, your eyes, your brain, to have that big of a bacterial and parasitic infection going on. You think of the square footage that your mouth takes up, and if you had a parasitic infection that large, that you were told you had that type of an infection on your leg or your arm or something, you'd be like, oh my goodness, but a lot of times when it's something like that's going on in the mouth, people say, well, it's not really bothering me. Yeah, my gums bleed a little bit, but and it's like, oh, like this is your body's sending up a flare. It's in trouble and it needs some help. This is a huge red flag.
And I think that's critical to recognize, is that these symptoms, whether we think they're significant or not, our body's trying to communicate something to us. And I think this is also the beauty of our body, that if we have an awareness and if we can be still with certain things, we can hear and feel our body trying to express, there's a problem. I'm crying out, like do something about this. And sometimes we don't know what to do. But in this case, you're giving people the opportunity and the visualization to see, hey, here is the problem. And this is just a piece. And I loved what you said, that with these spirochetes, they can burrow into things and then get from the mouth into the bloodstream, into the lymphatic system. And it's really interesting. Often when I test people, if they have with chronic illness, I'll do muscle testing and look at their gums and their sinuses. And it's fascinating, crazy to see what we find up there. Different types of parasite, different types of nematode, protozoa, and then getting up into the sinuses. And some people are like, wait, I have parasites up here? And it's like, yeah, that may be where the first place they came from, and why it's so prevalent in the body. And we think of, like, where are portals of entry? Yes, our skin, but you go back to what we kind of started with mouth breathing, and you're breathing in contaminant air. Sorry, folks. Glyphosate is measured in some places in 75% of the air and the rainwater. In the U.S., this is not outside. This is in the U.S. where that's measured. And then you have stuff that's sprayed overhead, that cloud seeding and whatever they want to call it. But if we're breathing in through our mouth or even our nose, right, this is still coming in to our body, and our body has to fight it off. And so where's the portal of entry? It's all around us. You're breathing, you're living. Thank goodness we have an immune system, but I really feel with the rate of toxic exposure that we have, that it's really hard for our body to make up the difference and combat what's going on.
Yep. And one of the things that I always like to point out too is like the just as, because most people in the functional medicine space and stuff, and most people listening are going to be familiar with the phrase of a leaky gut, right? Leaky gut is often what brings people to functional medicine. They start having weird symptoms or something going on, right? And so they identify, okay, I've got a leaky gut. Well, there's such a thing as leaky gums. And just as the gut is a protective barrier, right? There's only certain things that are supposed to be let through, right? And it's when those gap junctions in the gut get blown wide open and different proteins and things start getting through that gut lining that aren't supposed to be, right? And then your body starts making antibodies against those or something. You end up with weird autoimmune conditions or those types of things start happening. Well, just as our gut lining is supposed to prevent certain things from getting through that barrier, the same is true with your gums. Your gums are a tough lining, right? Teeth are the only, it's kind of a weird thing, but like, teeth are like the only visible part of your skeleton, right? They're protruding out, of your gums. Well, your gums are then a tight barrier that protect your body from everything on the outside. It's this tough rubber band like lining, that's super tough and strong. Well, if the gums are compromised and these bacteria blow holes in it, and the amoebas and parasitic infections contribute to gum permeability, well, as those gums become more permeable, we develop leaky gums. And those leaky gums, then proteins and bacteria and other things are able to get through that barrier that are not supposed to get in through that barrier, and they start wreaking havoc elsewhere in the body. And that's why periodontal disease is implicated. It is one of the major contributing factors to, again, a whole host of issues from, cancer, again, diabetes, heart disease is a huge one, among other things, even down to like impotence and sterility. I mean, it's but when you can see this visual and understand how these things work, that on my end, seeing where they're like how they're burrowing through the tissue, and then on your end, actually seeing that you're picking up on that in the bloodstream, it helps really kind of connect those dots that like our mouth is not some separate entity that exists apart from our body. Even
Right.
though in the insurance world that's the case, but in reality, right, that's not the case.
Now here's a question. So some people might see that and they're like, oh man, okay, I need to go home. I need to get some antiseptic. I need to
Yeah.
get, I forgot even the name of it, but I need to get this stuff. I need to rinse. I need
Yeah.
to do this every day. Um, is that a solution, or is that a Band-Aid, or is that just the wrong route to go,
Yeah,
period?
well, I mean, it is one of those things. Definitely, you want to like have some direction, right? Because if people see that and they like go rush through the grocery store and like swallow a bunch of Listerine, a bunch of these, especially these commercial mouthwashes, they're frankly they're garbage. They're toxic, in their own way. They're I mean, Listerine. A lot of them have alcohol in it. It destroys the good bacteria and the bad, and it's acidic. That's the other crazy thing is the Listerine actually has a very low pH, lower. It's like around a 4 or something, and teeth start to dissolve around a 5.5, and so that's just kind of insane unto itself. But
So that would be eroding the enamel in the teeth. Yes.
correct.
Hmm.
I,
Crazy.
I
Yeah.
don't understand it
Let's
even a
give you
little
a
bit.
product that is helpful, but actually it's
Yeah,
hurting. And
it
if you're
gives you
doing
fresh
that
breath
daily,
for 10 minutes, and then it
oh
destroys
my
your oral
gosh.
bacteria and erodes your teeth.
Yeah.
So it's definitely something that there's a method to the madness, even as far as what we do then with that. And if they're under the care of a functional provider and stuff, I usually have their functional doc, kind of quarterback an actual parasite cleanse. We have parasite cleanses available in our clinic, and generally works really well, especially for those that are kind of familiar with the process and stuff. Um, and so we can do that. We also do ozone irrigations in the gums. These are anaerobic bacteria that don't like oxygen, and so we blast it with a full dose of oxygen. Um, and For those that aren't familiar with ozone is I mean, it's pure oxygen. It's O3. The stable form of oxygen is O2. That's what we breathe. But the unstable oxygen on an ozone molecule wants to peel off and bind to something, and it oxidizes it. And that oxidation process kills these microbes that like to hide out in the gums where there's not as much oxygen. And we can take a before and after slide. We take a slide before treatment, and the spirochetes are all over the place. We take a slide after treatment, and it's not sterile, but we can see. We do an ozone treatment in tandem with a laser treatment, and then we take a slide, and we're able to see the immediate difference in what bacteria and stuff we're seeing on the slide, and it's pretty remarkable in and of itself. And then we want to see people back and make sure that our therapies are working, right? There's
Right.
some different supplements we'll put them on. We'll like I said, put them in touch with a good functional medicine doc if they're not in touch with one. And then they, start working on balancing things. Because if your mouth is out of balance, like I said, your mouth is a red flag. It's a canary in the coal mine most of the time. That there's something else going on downstream. Like what caused uh, this situation, this opportunistic infection to exist in the first place. And so if we can correct that and get the entire oral and gut microbiome back in balance, because we see every time we swallow, right? You picture thousands and thousands of those, upon millions of those bacteria going down in the gut. So there's a little bit more to it than that, but between on our end, that's kind of what we do. We'll put them through a number of regimens and stuff with the laser, with the ozone treatment. Like I said, there's a few different supplements that we'll put them on. Some of them target spirochetes specifically or some of these other things. But and then we're able to, like I said, follow up and measure and check in real time. Right, it's easy enough to reslide. It just takes a few minutes, and see, is our treatment even working? Is what we're doing working? And if it is,
Yeah.
wonderful, we stay the course. And if it's not, if we're still having some issues, then we retool and we redirect and stuff, and we can do that.
I think that's really cool to be able to reassess, right? And not just, hey, the procedure's done and you're
Yeah.
good, but to go back and be able to look and to make sure. I remember, and this was different, but I remember having a shoulder surgery years ago, and it was physical therapy, but there was never one appointment again with the orthopod that he was like, "Yep, looks good. Okay, see ya." And yet there's been chronic instability with that shoulder ever since. There's no way to follow up, and so I love the fact that you bring them back. Same visit, you can look at that, but hey, come back. Let's look again to
Yeah,
make sure what
like
we're doing is
we
working.
have to, because
Right.
like, and even with to kind of go back and revisit that whole idea of scaling and root planing and stuff, that kind of kicks off the initial gum therapy. Like, so if that level of intervention is necessary, where we actually do need to scale and debride underneath the gums, and then we and that's a whole nother level. Like I said, that's a surgical procedure. Well, we do the scaling and root planing, we'll still do the ozone, we'll do the laser, but that kind of like kicks off the therapeutic regimen, right?
Mm-hmm.
And so many people too, they're like, okay, I'll bite, I'll do this $500 deep cleaning that you're telling me about, and then they do it and they're like, okay, I did it, I'm done. And then they disappear, and
Wrong.
then they don't come back
Yeah.
for a year or two or something, and they come back and their mouth is still a mess, and they're like, well, your deep cleaning didn't work. And it's like, whoa, whoa, whoa. Like, that's not how this works. It's not as much as I wish it was as easy as just, everybody nowadays wants the easy button. They just want to push it and, like, push the button, swallow the pill, do the thing the one time, and they're like, oh great, okay, and now I should be cured. And it's like, well, it's not quite how this works.
Right. I mean, that'd be like getting a whole exercise regimen, doing it one time,
Yeah,
and
like
then assessing a month later,
like
like,
I've been
"Dude,
terribly.
how come I'm not bigger? What's going on? My performance still sucks."
Yeah,
So
yeah.
yeah, you have, and that's one of the things with health that people often ask me, "How long do I have to do this?" And I'm like, "Well,
It's a lifestyle change.
yeah.
It's
How long do you want to live? Like, how long? And not how long do you want to live? Saying that we can change, lifespan or add years, but it's like this is not just a one-time thing. This is your life.
right.
This is lifestyle. This is improving quality of life.
Yeah,
And so it's not something that you just do once or twice and then great, I'm good. Our bodies don't work like that.
right. Well,
Nothing works like that.
and it's just like when my daughter started showing signs of autoimmune, it was that. It wasn't like, okay, we can just, like, we'll just clean up our diet for a day, for a week. It's like, no,
No,
it's not how
it's
this
it's
works. Like,
lifestyle.
it's got to change, period.
Yeah,
So
absolutely.
yeah. So anyway, so that's, hopefully that's helpful to some
Yeah.
people who may relate to that.
Well, this has been fantastic. I think that the things that we've touched on, one, the visual will help, but then the processes that you've shared, talked about how that happens, I think is so valuable. And I would tell people, please like and share this with others. This goes beyond, this is frontline. Like, this is where, hey, if I'm not getting this at my dentist, and not, again, you're the first person that I've ever seen use the microscope, but just like in medicine, not everyone's the same. Not everyone does the same things, and there's different specialties, and there's different things, the way that we look at things. So if you're not satisfied with where you're at with your dentist or your healthcare provider, ask questions.
Yep.
Be curious, right? Don't relent until you have the answer, kind of like what you did and continue to do. Any final thoughts on what we've talked about, on anything?
No, I don't think so. I think we covered quite a bit. There's always more to talk about. There's always more to cover and stuff.
For sure.
And maybe next time we can talk a little bit more about. I'd love to spend some time on like the internal defense systems of the tooth, and kind of tooth remineralization and all that kind of stuff. That'd be a
That'd be
fun one
great.
too.
I would say yes. Let's do a part 2 on that. I'd be very fascinated in that as someone personally that as a kid, like it didn't matter what I did. It was cavity,
Mm-hmm.
cavity, cavity. And it's like, what the heck?
Yeah.
I floss, I brush, I do these things. And yet, and my dentist was like, well, some people, that's just how it is.
Yeah.
I'm like,
Or let's slap some more fluoride on it.
I don't believe that. So anyway,
Yeah.
I would love to do part 2 and talk about remineralization of the teeth and how you go about doing that and what you found. That would be fantastic.
Yeah, that would
So
be fun.
definitely have you back.
Okay.
Where can people find you?
Yeah, so I guess so. My practice is in Eagle, Idaho. BioSmiles is the practice. Biosmiles.com. And I also am on Instagram as the Boise Natural Dentist. So you can find me in those places and stuff. But
That's
yeah,
what it's at Boise Natural
the Boise,
Dentistry.
yeah, the Boise Natural Dentist.
The Boise Natural Dentist.
Yeah,
Okay.
yeah,
Check them out, follow them. You put out a lot of great content, which is really cool, that helps to educate and helps people understand like how not just important, but like, dude, this is your health.
yeah,
It's not just, this
yeah.
extension of your body, your
And we try and
teeth.
have fun with it. We try not
Yeah,
to be
no,
such a
it's
stick
really
in the mud
cool.
about it. So
So
yeah,
this has
good
been
stuff.
awesome. Thanks so much for coming on. Thanks for taking your time today. And we will definitely do a part 2 soon.
Okay. Hey, thanks, Doc.
You're welcome. So please like and share. This is how we get this word out, and keep it real. Until next time.